When decay affects a tooth and is left unchecked, the decay-causing bacteria can destroy the tooth beyond saving it, ultimately leading to tooth loss. The socket, when healing, will result in a loss of bone at the side and around the nearby teeth. The result of the missing tooth and bone loss in the area is a shifting of adjacent and opposing teeth into the space left by the tooth loss. The result of these teeth shifting is that it becomes much more challenging to keep the teeth clean, leading to areas with high accumulation of plaque and tartar that cause inflammation and increased risk of decay. The shifting position of the teeth may also result in a change of the bite, which over time may lead to 1. Poor function and grinding, 2. Changing of the position of the teeth due to the imbalanced forces, 3. Fracture of the enamel of the teeth along the gum line, also known as abfractions, 4. Excessive wear on the teeth, 5. An overall imbalance in the muscles of chewing and signs of popping, clicking, or pain from the temporomandibular joint, also known as TMJ.